COVID-19 is no doubt by far the biggest public health crisis in the 21st century and one of the most influential pandemics looking throughout history. We believe studying this disease will provide our society with valuable lessons to better cope with similar pandemics in the future, including possible second waves of COVID-19. Today, we present our findings by investigating the social and policy factors that play a role in the confirmed cases for 12 representative countries and forecast the future growth in infection numbers using the factors identified. We solve the problems using the following statistical and machine learning methods, which will be discussed in details later.
From the graph, COVID-19 is an ongoing global pandemic with high infection rate. Until June 30, there are 11.5 million total confirmed cases. Among them, 40% are from US and 20% are from Brazil. We're going to further analyze factors that may influence for COVID-19 spreading and prevention. First, healthcare system of a country is a vital factor in the premise of flattening the curve. Hospital bed availability is considered as a representative factor in our analysis. The boundary point for hospital bed availability per 100,000 population is 4. The analysis demonstrates that after exceeding 4 beds available per 100,000 people, the pressure for the national health care system will be drastically reassured. Then, to evaluate the effectiveness of lockdown policy, we first conducted research on lockdown dates for countries. Using lockdown date as a critical point, pre-lockdown data was used to fit in prediction models. For post-lockdown data, the logistic model was utilized to forecast the expected result for effective policy, because the logistic model tends to be flattened at the end. Then, an exponential model was applied to predict the result for ineffective policy, because the exponential model tends to be out of control as time passes by. The goal here is to construct a time series model and compare the actual data with 2 prediction models. The results are shown here. The red line represents the actual data, and the blue line and yellow line represents the prediction results from the logistic model and exponential model, respectively. Our analysis turned out that for countries with flattened curves, the logistic model simulates the actual data better, and there are time lags between the turning points. For countries with steep curves, the exponential model simulates the actual data better, but the growth rate of actual confirmed cases is smaller. Therefore, lockdown policy is effective in general and should be implemented as early as possible.
We can also analyze the effects of lockdown policy by looking at the mobility data specifically. The graph illustrates the change of the retail, transit, and workplace data in Canada from the baseline since the beginning of the outbreak. Many regulations have been set up to enforce the social distancing, such as international travel ban, restriction on public gatherings, school closures, work from home policies, and more. We choose public transit data to represent the mobility level. We can see sharp decreases in mid-March as all 8 countries have conducted social distancing interventions. Italy had a drastic decrease in transit after cases soared in early March. The United States had a relatively less decrease, which reflects its lockdown policy was not conducted as strictly as other countries. We further investigate the effectiveness of social distancing by plotting the mobility data and the increased speed of confirmed cases. The 8-line graphs show the strong correlation between them, but with a lagged effect. Calculating the cross correlation with different time lags to pick the lag value with highest correlation, which will be used in our regression models. Recently, many countries took steps to reopen the economy. There's a surge in daily new confirmed cases in the US. The new record high of 38,000 daily confirmed cases on June 21st was 2 months after the previous peak took place. On the contrary, the daily confirmed cases in Canada decreased steadily after a slight increase at the beginning of the reopening stage. We used a multilinear regression model to describe the daily new confirmed cases based on lagged mobility data and active cases. The output values are close to the actual data, which demonstrate the strong relationship. The results suggest that we need to remain locked down for a sufficiently long period of time, and we must be cautious as we are planning to lift the restrictions. One important factor to consider is whether we have passed the peak point.
To forecast the timeline of COVID-19, We want to estimate when the first wave will start to die down around the world. We did this by constructing a neural network model, which takes social, policy, and demographic factors as input, and uses the regression method to predict when countries will reach the turning point. The specific factors we used are indicated in the top left. The graph shows a linear relationship between the days to peak and the total confirmed cases. So we know that the longer it takes to bend the curve, the more infections it will result in. We first performed data cleaning to eliminate countries with too little cases to be considered an outbreak. Then we classified the countries into two groups, growing and slowing. Slowing groups indicate countries that have seen a peak in the 5-day rolling new cases. And growing represents countries with increasing daily new cases and have yet to see a peak. There are only 35 countries with record-breaking daily new cases at the moment, and the rest are in the slowing group. After building and training the model, we want to validate it. The diagram on the left shows the predicted versus actual days for our testing dataset, and the table on the right includes some predictions we made on May 31st for the preliminary round. Both comparisons show very little discrepancies, which is consistent with a mean absolute error of 8 days. We now make predictions using the model. The table on the left shows a few selected predictions. We can conclude that the first wave of COVID-19 should die down by the end of July. However, an issue we observed is that in the overview of the peak date on the right, the dates should have already passed for half of the growing countries already, and we take a closer examination at this problem. For demonstration purposes, we selected 4 countries, as shown in the table and graph. Their first peak days are relatively close to our prediction, but unfortunately, a second wave have emerged. We can conclude that this algorithm is relatively robust, and the first wave will die down by the end of July. However, second waves of COVID-19 will take place if preventative measures are not taken consistently.
In order to have a better understanding of the epidemic trajectory for each country, the last step we took is to predict the future by time series modeling. In this step, we applied the ARIMA and SARIMA models to forecast the future daily new cases for 15 days from July the 2nd to July the 17th. By log transforming and differencing the original data, we proposed several time series models and selected the final one by analyzing the goodness of fits and the predictive power. The predicted results are shown in these 2 plots. From the plots, we can see that a downward trend in the future daily new cases is predicted for countries such as Canada, China, Korea, Italy, Russia, and the United Kingdom. This is not surprising because from our previous analysis, these countries have effectively controlled the spread of the virus by the following, such as the government's quick response and decisive supports, the complete healthcare system, and the effective implementation of the lockdown policy. However, the forecasting daily new cases for Brazil, India, Iran, Mexico, South Africa, and the United States are not optimistic. The forecasting daily new cases will continue to grow quickly in the next 15 days. The impact factor might be one or all of the following by our previous analysis. This might include high population density, failure to implement the lockdown policy, slow response of the government's incomplete healthcare system, and limited testing capability. For these countries, urgent measures are needed to stop the spread. This leads to our conclusion of this project.
In this project, we first analyzed the factors listed below and forecast the epidemic trajectory. The potential limitation of our analysis is that only the most significant factors have been taken into consideration, and the official number of cases might be incomplete due to lack of test kits.
Based on our research, the short-term solution includes implementing strong containment policies during the early spreading stages of COVID-19. Social distancing can effectively control the outbreak so that the healthcare system will not be overwhelmed by sudden increase in confirmed cases. After the strict quarantine period, the government still need to raise public awareness of precautions and take cautious steps to ease the restrictions. In the long term, the government should work on developing contingency plans for public health issues and enhancing the capacity of the national healthcare system. Thanks for listening.